It is just a huge honor for me today to be podcast interviewing Dr. Friedrich Widu, DDS. I'm not going to say orthodontist in German. I'll try Kiefer Orthopaed.
That was pretty close.
That was pretty close. Let's hear you say it.
Kiefer Orthopaed.
Oh my gosh, I won't even try that. He's an orthodontist at Smile for You, 2C MedTech, Smilike.me in Berlin, Germany. Developed the Two-Clear system that combines the advantages of bracket wire technology and aligner therapy. He started with Invisalign in 2001 and has treated almost 4,000 cases. Deficiencies in the aligner therapy was the driver to invent the hybrid technique, since not all cases could be treated with aligners. Hybrid technique solves this problem. It is a replacement for the traditional fixed appliance, as well with tremendous advantages over the traditional method. Treatment with aligners require a high level of experience and ongoing training. We have been awarded diamond status for our commitment and the quality of treatment in the therapy with Invisalign. In Germany, we are one of the top 3 Invisalign users. He has already given more than 10,000 patients a new smile. Smilike.me stands for a particular comfortable orthodontic concept that makes the treatment of misaligned teeth easier than ever before. He specializes in giving you the smile you always wanted within a few months with the help of invisible aligners. How does he do it? He's pioneers in the application and further development of the so-called aligner therapy. And my gosh, ever since those patents expired about a year or two ago, it seems like a lot of innovation is coming out in the clear aligners. Would you agree?
Yeah, I think it's two drivers to the market. Yes, patents that run out is one, and it gives a lot of opportunities to direct to consumer brands. Now, as a doctor, obviously, I have my own opinion about direct-to-consumer brands. But on the other hand, it gives the opportunity to companies that try to compete with Align, who is definitely benchmark in aligner technology. And that is, of course, now a very dynamic market. It goes also along with digitalization. It's clear that we move towards dental worlds where scanning will replace impressions, where on-site production of crowns and inlays will be something that also the patients demand. And obviously in orthodontics is still a huge way to go from the traditional wire bracket method, but it is something that the patient is demanding, and this is the way we go.
So, when you say that, some cases can't be just treated with clear aligners, I mean, obviously there's some people out there that disagree. There are some orthodontists who say that they can do 100% of everything with Invisalign. Well, how would you answer that?
Well, obviously, clear aligners have come a long way, and now it's definitely a more powerful tool than it was in the beginning, and that is the end of the 90s when align technology came up. But obviously, you have cases that are surgery, you have cases with ectopic canines, you have cases that need heavy rotation and angulation correction. And I hope I'm not getting too deep into the expression mode of a dentist, but I think that most of your listeners are probably familiar with dentistry and probably also with some orthodontic terms. So
probably everyone's a dentist, and this goes on Orthotown too. So probably everyone's a dentist or an orthodontist, most likely.
So then it's okay to continue like that. So
yes,
I would say you can definitely do a lot more cases with aligners, but if you are honest, the surgery cases they still are surgery cases, and if you need mandibular advancement, you would use a tool for that, and you need palatal expansion. There are tools for this, and I mean, it's like with everything else in the medical world, you have to use the right medicine or the right tool. And if somebody says I can treat everything with one tool, I think that's a little bit a marketing phrase. It's like in former times, orthodontists said, "I treat everything with extraction. I never extract." You know, that's an extreme position, I would say.
Yeah, when general dentist, it's tough for orthodontists. What advice would you give to an orthodontist when, say, there's 10 dentists in his town that refer to him, but one of them is an extremist and doesn't believe there's ever a case for 4 bicuspid extraction? And how would you deal with that person? I mean, it's an extreme position, and I don't know of any orthodontist who would say that they've never seen a case that didn't need 4 bicuspid extraction. Would you agree with that?
Yes, of course. You know, it's like if you want to sit, I don't know if you know this car, Fiat Panda or 500, the Cinquecento. It's a very small Italian car. If you try to sit 5 fat people in the back row, they will not fit. And this is the same with big teeth on a small jaw. So if somebody comes up with, yeah, we shouldn't extract there, the question is, where do you want to put the teeth? You mean outside of the bone? Of course, it's possible to level in a manner that you have a very broad arch and very protruded teeth. And even if you do slicing, you know, you cannot exaggerate on that either. So it will just not fit, and it will look strange, and most of all, you will have recessions. So if a dentist doesn't understand that, because he has a strong belief that bicuspids should never be extracted, then probably I would try to not work with him. I don't know. Sometimes you just don't get a solution. You know?
So, do you have an English website? The Smilike, a play on the word smile and like. So it's Smile, SIMSMILE, that's in German, and Smile for You's in German. For English listeners, do you have a website on this in English?
For my German offices, I'm afraid we don't.
So talk about this journey. Is it intimidating to sit there and have a new concept and go against a big monster company like Invisalign? I mean, is that pretty intimidating to go after, or how did you see that?
I think that whenever you come up with a new idea, you have to convince people. It can be different kind of people, you know, maybe investors, maybe your colleagues, maybe patients, customers, and that's difficult. And after all, you maybe need a long time till you convince a group of people. So for me, it's not very intimidating that other players are on the market, because we don't compete directly with a clear aligner product or a bracket product. It's a hybrid technology, and it has some advantages that is proprietary to that technique. So might be considered a niche market, but I think it has a tremendous potential, and it's actually pretty much self-explaining. So hybrid technique means that we use a bracket, but then we switch to aligners, because this bracket is so thin and has such a low dimension that we can work with it underneath the aligner. So we do the leveling and the aligning, which can be done very good with the wire and very fast, and then we do the finishing with aligners. So this is something that an orthodontist actually understands, because after leveling and aligning, after the end of the fixed appliance phase, they were using and still use positioners. So actually it's a concept that is easy to understand.
And why don't you explain your concept of the hybrid therapy? I mean, we both know there's obviously cases. I mean, take an example where a root canal has failed and you're trying to move the second molar into the position of the first molar. I mean, there's just a lot of complicated cases that you're saying just aligner therapy is not going to work. But explain your hybrid therapy technique at the orthodontist level to the orthodontist listening to you right now.
Well, usually it's like that. When I started back in the days in 2001, with aligner therapy, and it was by then only Invisalign. I also thought about other options, how I can treat a patient invisible, because I had a lot of adult patients. And that was lingual. Back then, lingual was a very small niche market, and then the technology had started to have a peak between 2005 and 2010, 11, 12, something in Europe. And this was because a new system came up. It was incognito, and that was very efficient and also user-friendly. And it was more precise than any other lingual technique before. By then, the aligner approach was not so efficient in many ways. It became better after Invisalign introduced, for example, smart-track material and also optimized attachments. But let's say 10 years ago, I was searching for something that is not as difficult as lingual and more effective than aligners alone. And I came up with this idea of the hybrid technique back in 2013, 2014. I went for a patent in Europe and then in the US and developed in parallel the prototypes, which means also, of course, producing them, but getting it in a legal way into the patient's mouth. And I worked with the University of Bonn to measure that. And we have seen that it is great to use the advantages of the wire technique and of brackets, and then not to have to debond to continue with the aligners for the finishing. The idea is to be very quick with the wire and to have a very small, thin appliance that is easy to clean for the patient and doesn't irritate the mucosa. And all these things, I think the appliance we have today accomplish this. And obviously, since the market changed, that the patents fell, there are so many companies now going into the aligner market that I think we have actually a good opportunity to develop further.
Yeah, it has been amazing how many companies have come on board. How many companies do you think are right now in the clear aligner business?
I have no idea. My feeling is that every week is a new one coming up, especially in China. But I think every bracket company now has a clear aligner division. I've even heard, I think it was GAC, who closed the bracket business completely to switch over to aligners. You know, sometimes it is even overstretching the envelope. I think that also traditional brackets will stay valid for orthodontists in the next 2 or 3 decades, and they have their advantages. But right now it's a total run, and I would say we have maybe 40 companies on the aligner market altogether.
Yeah, 40. That is a lot of competition, a lot of innovation. It always makes me go back to the greatest CEOs in the high-tech space, mainly Andy Grove of Intel, the founder of Intel, and oh my gosh, who was the manager of Cisco Chambers for years. And they always asked him, how do you know, how do you pick the winning technology at the beginning of the game? And they both said that they both had the same strategies. They said, we watch sales every quarter across all the competitors, and the minute one of them has a 10x breakout, it's the winner. And so you'll just watch these 40 clear aligner companies and say they all sell 1 unit a month. Each month it's 1 unit. Then all of a sudden one company sells 10. For some reason, the market has spoken, and that's how they always pick their winning technology, which is amazing. So I'm going to start with some early benchmarks. What % of the orthodontic cases in Germany done by orthodontists are done clear aligner versus brackets as of 2020?
Oh, that is a good question, because there's not necessarily a totally official statistic on that. But if you believe the companies, it's going to be maybe 10%. But you have to know that in Germany, we have a pretty conservative system, which means that the insurance pays for children and adolescent treatment up to 18. So aligner treatment doesn't participate in that. So sometimes families have to decide if they get a paid treatment by insurance, which of course, if you have 1, 2, 3, 4 children, it is something that you think about. And I would say that below 18, the percentage of aligner treatment might be less than 10. And if you're talking about adult treatment, it might be something like 25%, 30%.
So you're saying the German dental insurance companies do not pay for clear aligner orthodontic treatment on children under 18?
Yes, because they would go for the most cost-effective medical solution, and that is understandable if it's an insurance company, you know.
So how would you how do you wrap your mind around a big debate is that orthodontics is just cosmetics. I mean, it just makes you look pretty as a peacock. It's just, you know, all primates want to find a mate and reproduce and have offspring. And then others say, oh no, it's a health issue. In a German state-sponsored insurance company, why would they even pay for orthodontic treatment on children under 18? Do they think there's a medical reason? Is it sleep apnea? What would be the reason a German child would have to need orthodontic treatment?
It's also a very good question. Like 45 years ago, there was a trial at a very high-level court. And the question was, does a patient have the right to charge for the treatment, the state insurance, because we have kind of like a state insurance. And by then, the court was not able to decide that 100% of the cases do not need treatment. So obviously, there is a percentage of cases that need orthodontic treatment because it's a health issue. This might be, for example, a crossbite where you have a mandibular shift, which is for growing patients something that can concern the temporomandibular joint. And obviously, a massive crowding can lead to teeth that do not erupt, might lead to issues that, difficult cleaning, can lead to gingivitis or even periodontal destruction. Premature contacts are an issue, or maybe preparation for prosthodontic treatment because the space you have is just not is sufficient for an implant. So there are medical issues, but obviously it's not 100% of the cases that have that medical issue. A lot of patients come because they need or want aesthetic improvement. So by then, because of this court decision, the law was that everybody can benefit, but there is an age gap, an age condition under 18. And if you do not go for an orthodontic treatment within that age barrier, then you have to pay for it. So that's the law in Germany.
So, my gosh, there's so many things. Another thing that people talk about is, this is my second virus rodeo I've lived through. I mean, when I came out of school in '87, HIV was the big virus, which changed all of our protocols, the gloves and mask and what have you. And that was a very serious epidemic that went on to kill 36 plus million people. But a lot of the things we changed are still in effect today, which made us more robust for this SARS outbreak. Some people think teledentistry is a permanent game changer in dentistry, and others think it's just something we'll just do during the pandemic. How did teledentistry, first of all, give us a, I know all the Americans and Canadians around the world would love to get an update on COVID-19 in Germany. How is the COVID, give us a COVID update. What's it look like now? And then the follow-up question to that is, has teledentistry helped you during the pandemic? And do you think it'll be a long-term permanent change where 10 years ago, whatever you're doing with teledentistry, you'll still be doing?
I think you have to make a difference between the part of treatment where you have to actively do something for the patient, which means, for example, you have to take a scan, or you have to, bond attachments, bond a bracket, change a wire. It will never be possible to do this, or at least not with the technology of today, with the patient that does not come into your office. What you can transfer to medical support is everything that is, for example, communication. Obviously, you can send him an aligner to his home. And obviously, even without Corona, it is maybe a great service also from the medical side. If you have somebody in Africa who needs advice or a diagnosis that you can do via cell phone, might save lives. It might be a lot cheaper. And if the next hospital is 100 miles away, that's the way to go. And probably we will go this way. But I don't see how I can treat my patients from A to Z just via Zoom or any other device that transfer video information or sound. So I think we will have for a pretty long time patients that come to our office. If you want to know what I have changed during Corona, obviously we have sent devices to our patients' home, and obviously we did more video calls. But to be honest, right now I'm doing exactly the same thing that I was doing 1 year ago.
And how does the coronavirus look to you right now? We're November 18th. Some people think we're having a fall surge and that it's going to get bad again. What do you see on the ground in Germany, and what do you hear about Europe in general?
Oh, we're facing now a light lockdown, and probably will face even a harder lockdown because our statistics say that we are going the wrong direction. So I believe that they are working very intensively on a vaccine that we will get within the next month, and hopefully we will get out of this pandemic situation pretty soon. So it's we have kind of a lockdown.
And it's just a huge country. I mean, there's 83 million people in Germany. Does that you already had a lockdown earlier, right? You had a lockdown in April?
That is correct, but then we had a lockdown where we could not even go to cut our hair, to a hairdresser. It was impossible. And now we have a lockdown where you are allowed to work, but you cannot go to a gym, or we don't have any open restaurants, and of course no bars, no pubs, and so on, and no public meetings. You cannot go to a football game as a spectator. That is affecting us pretty much. I don't know exactly how it is in America, or how it will be now after the election. But in Germany, it's pretty much like that, and there is not clear if we will, end this lockdown within the next weeks, maybe before Christmas, because obviously hotels are also closed, so no vacation.
So, do you think the upcoming lockdown will close orthodontic offices, or is it mostly bars and gyms and soccer games and things you don't need? Or would an orthodontic practice be considered an essential service and be able to stay open as usual, or will it curtail your practice?
Or I think if they start to differentiate between what is essential and what is not essential, that is a very difficult discussion. So at the end of the day, we are medical personnel, and obviously we have patients with active appliances out there, and I think it's not fair to leave them without assistance.
So what do you think they'll do?
I don't think I don't think that they should, and I don't think that they can close us for months.
Yeah, I understand, things you don't need to do. Like, you don't need to go to a bar. I mean, and I'm saying that, and I'm even Irish. I mean, when's the last time you heard an Irish man say you don't need to go to a bar? But actually, you don't. You can drink at home, alone in the room in the dark. But I think that dental offices. I mean, they've been dealing with HIV for 3 decades. And I mean, I just think that they can, and then when you go into hospitals, there's definitely parts of the hospitals that I don't think are as successful as dental offices. I mean, they're doctors of dentistry, and but these are very strange, interesting times. The aligner therapy, to me, was kind of a next generation of lingual therapy. I mean, I remember back in the 80s, I mean, everybody didn't want to show their braces. So it seemed like braces went to clear brackets, so there'd only be one wire. Some dentists were doing lingual, so you couldn't see it on the other side. And this aligner is just another iteration of this this process. Did you ever do lingual, and was that a solution of having clear aligner therapy by having lingual braces, or did you see that as a no-go?
Oh, I think, here we have a lot of issues. Obviously, lingual is great. It's fantastic technique, and I find it very demanding to learn. But I like demanding things. On the other hand, obviously, it gets, at least in Germany, more and more difficult to get highly qualified staff. And you need this highly qualified staff for lingual. So that is one reason why maybe less lingual cases are done. On the other hand, there's a strong marketing activity of the aligner companies. So a lot of patients come to the office, and this is what they are demanding. They're excluding lingual from the beginning because they're afraid that it might be painful or the speech might be altered. So they come and they're already prepared to go for aligner treatment. With adolescents that are still growing, where we have teeth that still erupt, that's a different issue. Obviously, there are aligner products also for these patients, but there we like to use our hybrid technique because it has a lot of advantages. So, as a matter of fact, I don't do lingual today anymore.
So, do you have is Smiles Direct Club in Germany? Or I know they're all over the United States, Canada, Hong Kong. Are they in Germany, or is there a similar type business model to a Smiles Direct Club going on now?
Yeah, we have the Smile Direct Club. They just opened lately. They were a little bit slowed down by the Corona pandemic. We have also other direct-to-consumer brands, but to be honest to you, I don't understand exactly what the value on top is for the customer. If it's a very reduced treatment, this is something that any customer can get in an orthodontic office or dental office, probably for the same investment of money, but he gets a highly qualified team. So if we talk about direct-to-consumer business and you sell an aligner, you don't provide a treatment, I think that is a little bit difficult. I don't not truly understand the concept, to be honest.
Well, to me, what's bizarre is in many countries, it's still illegal for a dentist or a physician, a doctor of any healthcare, to advertise. I mean, I live in Arizona, which was actually the state where a couple lawyers in 1973 took it all the way to the Supreme Court because they said that not being able to advertise was a violation of freedom of speech. And I just think it's bizarre that do-it-yourself orthodontic companies are starting to operate in countries that don't even allow doctors to advertise. I've been to Germany every 2 years forever because I think the best meeting in the world is the IDF meeting in Cologne. And I mean, my gosh, I am in love with Cologne. I could, what is it, the IDF or IDS?
It's Internationale Dentalschau, the IDS, every 2 years. Yeah, that's a great meeting. That's true.
Yeah, it's the IDS, right?
Yeah, it's the biggest fair for dental in the world.
Yeah, and there's usually over 100,000 dentists there. And what's so interesting is you at any time you're at a booth and you just ask the doc next to you, where are you from? I mean, it could be from Morocco to Brazil. I mean, it's just the whole dental world is there. And Cologne was the farthest outreach of the Roman Empire. So you have the old Italian Roman Empire walls, and you can have the best Italian food and the best German food and the best. I mean, I just absolutely love it. When is their next meeting?
That is a very good question. Again, you're just asking fantastic, good questions, Howard. I don't know, because obviously all meetings have been postponed and nobody knows exactly when we will get going again. Yeah. So I think it was supposed to be in March, even next year. Yeah, but I don't think it's going to happen.
Yeah, it's scheduled. It's scheduled for March 10 to the 13th, 2021. And I don't even think, as an American, I don't even think I could fly there. I mean, a lot of countries are not letting Americans fly in because we're a big hotspot. So, my gosh, they've got to decide pretty quick. I mean, March 10th will be here in no time. But you're guessing they're probably not going to have it this year.
I'm guessing they're not going to have it. Yes, that's correct.
Wow. And I also back to the do-it-yourself companies like Smiles Direct Club. I think of Germany as, like you say, a very conservative country, especially in dentistry. I mean, I only deal with it in dentistry, whether it's Ivoclar and Liechtenstein or Sirona and Austria. I just have a hard time believing that the German dentists would allow a do-it-yourself company and advertising on television and all that stuff. Do you think that's something that they'll liberalize and do, or do you think the conservative dental industry in Germany will put up a lot of roadblocks, whether it be with laws or what have you?
Well, we are indeed a conservative market, but on the other hand, the internet is working everywhere. And to get back to this topic, direct to consumer, you generate the patients in the internet with adverts, Instagram or Facebook. You tell them a story, how great this treatment is, and they believe you. Yeah, and obviously, it's difficult to go and say this is the law in Germany and it's forbidden, because everybody can order something via the internet, and you cannot really make this illegal.
Yeah. I'm always trying to decide if something's new and fancy and a fad, or if it's really going to impact dentistry. And sometimes it takes forever to find out. Like take Sirona. I mean, that started in France, and I moved to LA when I was in dental school. I think in 85 or 86, one of my teachers said that before I even graduated from dental school, dental laboratories would be out of business and be replaced by this chairside milling. But it never really got more than 15% of the U.S. dental market, general dentist chairside milling, like crowns. And, compare that to digital radiography, which hit 80%. So I'm still not convinced if chairside milling is a fad for high-tech dental geeks who just love that. They always want to be a glorified lab technician. It's obviously not mainstream. And now I'm wondering the same thing about clear aligners. Do you think in 10, 20 years that clear aligners will be mostly milled and made chairside in the dental office, or do you think you'll be using digital scanning and sending it to a lab and having the aligners delivered straight to you or the patient?
Oh, we will have both. If you look at 3D printing, we are already now able to scan and print within 2 hours the model, maybe even faster, and it becomes every month faster. And then you can make a digital setup, and you can deliver the first aligner the same day. Now, obviously, I don't know if this in ortho is such a tremendous advantage, because if you want to start straightening teeth, you can bond brackets and you start also the same day, with an active wire. So obviously, orthodontic treatment sometimes years. So I don't see such a big difference if you deliver the liner at the same day, but I think it can be exploited marketing-wise. In the future, I strongly believe that chairside milling will become more precise and cost-effective, and it will be growing. But also companies that produce larger quantities can have very streamlined processes and be price competitive and comply with all rules by FDA and other organizations. And transferring a good from A to B, if you have hotspots, might be also very, very fast. And look at Amazon, what they're doing is amazing, overnight delivery and so on. And I think this is going to be valid also in the future. So yes, you will have probably both products.
And do you have any favorites of 3D printing companies? I mean, is it Sprint Ray? Is it any of them that, are you using any of them in your office?
Yes, of course. You have great 3D printers in America. For example, Ray's. What I like about fusion filament method is that it doesn't need so much chemistry. You get a filament, and you can produce models that are biodegradable, and it's very precise. When I started to use that, nobody believed me that it's precise enough, like 1/10 of a millimeter. You would use something else than millimeters to count, but for me that is easier. So
which company are you talking about? Which company are you talking about?
Ray. The company, the printer is called Race, and has a number, I don't even know which one, but the company Race is an American company.
Okay. RAISE?
Yeah. There's the Race 3D Pro 2, and can buy them in Europe for like 4,000 euros.
Oh, okay. I know. Okay, Raise 3D. Raise3D.com. Okay, I got it.
Raise3D.com, dual extruder 3D printer. I have great results with that, printing models. Sometimes I print models to just give them away as a present for the patients after a scan. So obviously you don't get models, for example, from a line, so you have to have another option. And I was doing my own aligners on my hybrid technique in my offices. And now, since we generated this company that is now an American company, I order my hybrid technique aligners with 2C MedTech, and I'm very satisfied.
So you are very satisfied. So do you what is your digital workflow? I mean, are you? I take it you're doing all impressions have been replaced from polyvinyl siloxanes to oral scanners. I mean, explain your digital workflow.
Well, I have an office chain. It's 6 offices in Germany, and 2 of them are fully digitalized, which means we do not have any impression material. We use exclusively scanners and 3D printers, and not the classical things that we do. And 4 offices are, I would say, conservative, and that is because we have some rules we have to comply with. So if it's, like I said before, insurance-driven treatment or paid, then you need to produce a classical model and you need to do impressions. I know that sounds very strange, like in ancient times, but this is how the rules are in Germany. So they are only to some extent digitalized, and we also use the traditional methods.
So what I know the dentists, when they're listening to someone that they respect their opinion, they always want to know your brand. And this isn't an advertisement for any company. In fact, it seems like if orthodontist, like Align Technology owns Invisalign and iTero. So it seems like a lot of the orthodontists go to iTero. It seems like if they're not doing any clear aligners and they just want a scanner, they like 3Shape from Denmark. So I just assume you went with the iTero scanner.
Yeah, I went with the iTero scanner. Obviously, it makes your life when you work with Invisalign easier, but it also allows you to export the STL files and use it for other systems. You can export it and print a model. So also for my clear aligner, for my hybrid iTero scanners, that was never a problem. So it made me flexible. So I don't have any experience with 3Shape, but I think it's a very good scanner as well.
So you have 6 orthodontic offices in Germany?
Yes.
I mean, that's a kingpin. I assure you that 99% of all the orthodontists listening right now or in America do not own 6 dental offices. Talk about that. I mean, were you a natural born leader? Were you just have a risk aversion? I mean, most dentists and orthodontists have a very hard time managing their own small staff, their own receptionists, assistants. It's very challenging. What was going on in your journey where all of a sudden an orthodontist can go lead a team large enough to open up 6 offices in Germany? That or you must drink a lot of beer. One of the two.
Yeah, it's you're right. It's pretty demanding with the communication and getting your staff to do the right things. But I would say it was more historically, it grew not by a concept like I want to have 6 or 10 offices. It just was that I, got a colleague that was very close to my first office and said, don't you want to buy my office because I'm going to retire? And I thought, oh, maybe it's a good idea. And this is how it was growing. While our digital offices, we created them on purpose in the biggest cities in Germany, Hamburg and Berlin, because we believed in 2016 and 17 when we opened them that it is a good idea to generate patients via the internet. And it's good to be focusing on a special portfolio and small portfolio, which is aligner. So we did not go for the whole spectrum that you can find in ortho. We did exclusively either aligners or our hybrid technique. And you probably can imagine that if you have a smaller spectrum of medical solutions that you offer, and if you digitalize every patient and you have a treatment plan that you can see from wherever you are in the world, it makes your life easier, and it makes things more controllable, and it makes your processes scalable. And as a matter of fact, we are one of the largest orthodontic offices regarding aligner treatment in Germany, with several hundred starts a year. And it's actually sometimes also a lot of fun to go this way. It's I learn every day something new.
And what is the name of the brand that you work under? I mean, because you own smileforyou.de, DE for Germany, for Deutschland, and you also have Smilike.me. What is the commercial brand that you use? Or are they all the same name?
No, it's indeed 2 brands for 2 different approaches. Smilike is the aligner and hybrid technique digital approach, and Smile for You is the classical ortho approach. So 2 different names. And Too Clear is our American company that sells the hybrid technique product.
So are they all the same name?
No, all different names.
They're all different names. So what is your strategy? We see that in the United States where the biggest DSO, Heartland, if they bought your office, it'd be Dr. Widu. And then there's other ones like Aspen, where every one of them is branded as Aspen Dental. And I'm not saying either is right or wrong. Everything's a trade-off. But what were you thinking when you decided to have 6 different names for orthodontic offices, as opposed to branding them all like Smile for You or something like that?
Sorry, I was not clear. So the classical offices, they have all one name, it's Smile for You. And the digital offices, they are called Smilike. And the idea was to have only one homepage where you can advertise, or one Instagram channel, or you don't have to make all your marketing products totally different. Every letter you write then has to look different. No, it looks all the same. It makes it a little bit more streamlined.
And I thought, and marketing, I mean, you have to have a flair for marketing if you're going to be successful in any business. And I really thought, I don't speak German, but on the smilelike.me, you smile like me. You use the domain name for the country of Montenegro, ME. So with the domain name, smile like me, that was pretty cool. Was that your idea?
To be honest, it was not my idea. It was the idea of a good friend of Olli Hahn, who is a great marketer, and he thought, let's do something different so it stays in the memory of the customer.
Yeah, smile like me. I mean, I never thought about the domain name for Montenegro until I landed on your site, and I thought that, that was just, gosh darn good marketing. I was going to congratulate you on that. Back to leadership skills. What advice would you give to the orthodontist listening to you that, since 1999, we're able to do surveys on Dental Town and Ortho Town, and we'll say, what stresses you out the most? And it's always people, whether it be patients or employees. I mean, it's never, I don't know how to diagnose this case, or I don't know how to bond this bracket. It's always people. What advice would you have to dentists in trying to deal with people when obviously for you to be leading 6 offices, you must have learned a lot?
I think 3 things are really demanding. Number 1 is, where do I generate the next patient if competition gets tough? Second is, where do I get my staff? It has to have the right motivation, the right mindset, and so on. And they have to function. And obviously, it's not only to find the right person, but it's also how do I lead these people? And third is, how do I streamline and optimize my procedures? And what is really demanding is, if you're all day long treating patients and you're in this operative business, do you have time to optimize these 3 topics? I think that is sometimes really tough.
And just to the Americans listening are confused about why it's Dr. Friedrich Widu. It's because he was explaining to me that if you have a doctorate from another country, it'd be one doctor if you were a doctor all trained in one country. But if you're have a doctorate from 2 different countries, it's a doctor. And did your journey begin in, was it Romania? Is that where you started out?
I'm actually born in Romania. Yes, I started back in the days when it was still a communist country. It was very interesting to go there after I finished school in Germany. So I was raised in Germany, went back to Romania, went then to Hungary, went back to Germany, finalized in Germany my ortho degree, and then I did a lingual master in Paris a few years later. So I had a very colorful dental journey regarding my education.
And what it was, how would you describe it to people who haven't lived in Germany or Romania? What was that like living in Romania?
Nowadays, it's actually a lot less of a difference. Now you get everywhere your McDonald's burger if you want, and also your Diet Coke. But 30 years ago, probably most people nowadays have no idea how it was in the Eastern communist countries. You could not buy a BMW or a color TV. It was just not the developed market. No, it was like let's say, like you would imagine China 30 years ago, or like some African countries are nowadays. It's just not the same infrastructure.
And do you ever worry that it could return that way someday? I mean, they always say history always repeats itself, and the political things have been very bizarre lately, to say the least. Do you ever worry that that type of management can return?
To be honest, I don't really understand what's the perspective of Europe and Germany, and especially in the next 10 or 15 years. When I look at how fast the technological development in Asia is, and how innovative they are, and how much commitment they bring in, then sometimes I have some questions about our economic development in Europe in general. I think we will face very hard times. I think America is a lot better off, and obviously Asia is just rocking it.
Yeah, I think China really got into the passing lane during this pandemic. I mean, they clamped down on it the fastest, the hardest, and they're like take luxuries. I was reading on Bloomberg this morning that luxury sale items, like you were talking about at BMW, are up 45% in this year, up 45%. Whereas in Europe and the United States, it's contracted, a quarter. So it's really this has been very advantageous for teledentistry, social media sites, any type of Amazon.com, where you don't have to go to a store and risk getting exposed to a virus. Online retail sales, as a percentage of sales, have already doubled in this year. I mean, 2020 saw the doubling of online retail. So, but China has been a major benefactor of this. Do you think the vaccine will be rolled out pretty quickly in Germany, or do you think will the German mindset of the people more trusting and will try this new virus vaccine, or do you think they're more skeptical and will want to wait and see how the first millions of people do?
Or if you can trust the statistics, vast majority is going to use it. And I think, it's a procedure. I mean, maybe in the next month we will have different producing companies, but the one that I have heard of is a joint venture of an American and a German company. They use a technique that has not been, it's done the first time, and what it really changes in your body over a bit of time, maybe it's not so clear. Let's put it this way. If you're 70, it might make a lot more sense to use it than if you're 30, First of all, you have the chances that it changes something within your body that you might, have the chance to live it is smaller, and obviously you're more in the risk group. So, yeah, I don't know. If you ask me if I will get a vaccine, I did not decide today. But I think a lot of people in Germany will be eager to get the vaccine.
And when you talked about the vaccine you were just talking about, which one of the vaccines were you talking about? That it was a different virus, different mechanism. Which one were you talking about?
There is the method that they extract the genetic information from the virus and put it and processes in a way that it can be injected into the human body. It's a process that has not been used before. I cannot give you more details. Obviously, some details are published now.
Is that the BioNTech and Pfizer? Or are you talking about the BioNTech and Pfizer? That one?
Yeah.
Yeah.
Yes, exactly.
So, I think in the United States they're going to first only give it to mother-in-laws and see how that goes, and then if it works, if
That's a very good idea.
um,
I have also a list of people.
oh my gosh, wouldn't that be nice if everybody could just submit the names of the people they think should be on the trial for that? But Dennis, want to know. I mean, you're a really smart guy. I mean, you're a double doctor. You were the first one in Romania to offer clear aligners, and then moved to Germany. I mean, you're an amazing guy. But so it's interesting to see. There's a big threat on Dental Town. Will you take the vaccine? And they're probably wanting to know how you would wrap your mind around this vaccine. I mean, would you want to see it roll out for a month, 3 months, half a year? What would it take to make you try this new BioNTech Pfizer vaccine?
The thing is that if 95% of the population gets the vaccine, then also the 5% who do not take it are a lot safer than before. So that's a little bit the strategy in my head. But, you know, if you use a new drug, you never have long-term evaluation, no? Because you need to work on the statistics and with a lot of patients over years and that is why this process of getting an approval by the FDA is so long. No? You want to be sure that also in the next 5 or 10 years, nothing bad happens. If you think back in the 60s, they had this anti-baby pill, Contagan, and you had a lot of, handicapped newborns. And that was, of course, a catastrophe. So there's a very strong and secure regulation for new medications that get an approval. And now we're doing it very fast because we're under pressure. So obviously, I think it's okay to have some, at least questions about this product.
So you were the first dentist offering clear aligners. I mean, the first orthodontist offering clear aligners in Romania. Was that a second iteration of aligners? I mean, did you used to do Inman aligners, or I mean, there's other types of aligners. Did you ever try the Inman aligner, and what were your thoughts of that?
To be honest, I never tried them. I tried another product that was by then called Clear Correct. I think it's still called Clear Correct, but it's now owned by Straumann. So it was bought by a Swiss company that produces implants. They bought an American company that produces aligners. I have to admit that was a few years ago, so maybe the product is better today. By then I was not so satisfied because it did not have the advantages that I was used to work within the system of Invisalign, and for the other cases that were demanding and the adolescents were demanding an aesthetic treatment, I used our hybrid technique. So no, I have no experience with. I mean, I have experience that I tried them, but I was not very satisfied with other products.
So why did you specifically not like the Clear Correct, which was acquired by the Straumann Group, which owns an implant company? I thought that was very interesting when it happened. And then they also, who did they just buy the other day? They also acquired
I think Sendura.
Dr. Smile.
They acquired Dr. Smile, and I think they also acquired Bay Materials. But Dr. Smile is a direct-to-consumer brand, yes, in Germany. Why I was not satisfied? Because the software tools that they offered by then were more limited than what I was used to work with. And the material, to me, was too stiff.
So I used to notice that when orthodontists would get upset with line technology, like when they started putting offices in malls, and sometimes you'd run into an orthodontist and he'd really be venting hard and upset, and I'd say, well, does that mean you are going to quit using line technology, Invisalign in your office, and you say, "Oh no, no, the material's better, it works better." So it obviously sounds like they're the Mercedes Benz of they have that brand in dentist mind. Do you agree with that?
It has a strong position in the market because they were doing it first, and they gathered a lot of experience over the years. So I don't know if they would start with direct to consumer production and marketing, if this would lead to orthodontics not using the product anymore. They're still buying Straumann implants, even if Straumann is investing in a direct-to-consumer business that is called Dr. Smile. So it's going to be very interesting how these things develop within the next, let's say, 5 to 10 years.
But what's amazing is, they bought Dr. Smile, which is a practice chain specialized in aesthetic dental treatments headquartered in Berlin. And they have 6 offices, and hell, you have 6 offices. So it's a interesting direct to consumer company, but it's really not that big though.
Yeah, they have a lot of partner offices on the other hand. So I think it's more the idea that was bought than what is really as a hardware there, because obviously. Dr. Smile does not offer any technical improvement or something, like innovation wise. It's more, the marketing idea. Let's sell something directly to the patient and let's sell it. At least give them the idea it's cheaper, because I don't really think you save so much money on that. No.
The United States is a really big country. I mean, it's it goes from one ocean to the ocean, so there's a lot of different countries in America. I always view America as the same as I do Europe. I mean, I would never compare Germany to Greece or Portugal to Denmark. I mean, they're very, very different countries. But in some states of the United States, general dentists get the feeling from orthodontists that they're not happy if the general dentist does orthodontics, like Invisalign. And yet here now you have companies that are like Dr. Smile and Smile's Drug Club, where hell, there's not even a doctor in the deal. How do the before Invisalign started taking off really big, what was the attitude of orthodontists in Germany and Romania about general dentists doing ortho? And if a general dentist was doing an ortho case, would they feel comfortable going to you, asking you questions or help, or is it just considered something that they don't like and would prefer they didn't do it?
Yes. Well, obviously, it's a big difference between, for example, Romania and Germany. In Romania, the law structures the market into ortho and dental, and if you do not have an orthodontist as a partner in your office, you're not allowed to do orthodontic treatment. There are, by the way, only 2 countries in Europe with that regulation. I personally find this regulation a bit strange, because a dentist has during his education in school also the topic ortho, and obviously he can learn a lot of things as practical work. So why shouldn't he do that? I mean, there are easy cases, not so easy cases, very difficult cases. It's going to structure already by that if he transferred to an orthodontist or not. I think it's something that it makes no sense to regulate by law. It regulates by itself. So I don't have a problem with that.
I know it's late at night. Germany is 8 hours ahead. We've gone over an hour. I swear I'll try to speed up my questions and shut up as quick as I can. A few last questions. There's a lot of companies that advertise accelerated orthodontics, different techniques, different products. Do any of them convince you that they're worth the money, that if you use this product, your braces will go faster, your treatment will go faster, or do you think it's more marketing?
That is also a very good question. You see, there are only some situations in that where self-ligating brackets really are indeed maybe faster than the traditional brackets. They're still sold very good. And I think it's the same with these products. So Excellent in Germany didn't make it to very good sales. And there's a second product that works with light. So Excellent was with vibrations. I think also
Was it the soft pulse technology? Is that what you're talking?
Yeah,
Okay.
Orthopulse. So if you sell such an appliance for 700-800 euros and the whole treatment is maybe only 5,000, then I think it has to have a tremendous advantage regarding speed of treatment. And I before I integrate it into my treatment, I need more valid data.
So you're not a fan then of Orthopulse or Excellent?
Let's put it that way. I don't have enough experience to judge, but they didn't convince me until this day to buy an inventor.
My gosh. Is there any other things that you thought we would be talking about today that we didn't talk about? Is there anything you're passionate about that you wish we should talk about?
No, I think we discussed actually everything. The thing that I really would love to see in ortho is that we stick to what we can really measure and what we get as a feedback from universities as a valid information, and less to what is promised by marketing of companies, smaller or bigger ones. So when we developed our bracket, we were always working with a university lab to measure, for example, friction, and to see what is the actual value that you have within that product. So it's not just an idea that you have. And sometimes I think there's confusion about what is indeed measured and what is a valid result by independent university studies, for example, or other organization, and what is just marketing blah blah.
One other controversy, I mean, I like to call it Dentistry Uncensored because I don't want to talk about anything everyone agrees on. I always want to ask good journalism questions, and thank you for saying great questions so many times. Another big argument that I see on Dental Town is between the orthodontist and the pediatric dentist. Some pediatric dentists do a lot of rapid palatal expander, and then that uses up a dental insurance benefit. And then when the patient comes back to get ortho, and when they're in high school and older, a lot of the orthodontists didn't see the value of the pediatric dentist intervention. How do you see the way pediatric dentists evaluate the bite and where this is going to develop versus the orthodontist? You guys in Germany and Romania, you see eye to eye, or is there a little disconnect there also?
Yeah, I think that in Germany, at least, these are two different fields of work. So the pediatric dentist has a group of patients that are within an age of 5, 4, 6, 7, 8, and that's not necessarily the biggest group of patients in orthodontic treats. So there is a gap in between. Like you go to the pediatric dentist because you need a treatment. Maybe it's not the easiest patient, and then a few years later, indeed, he comes to the orthodontist. So they don't communicate too intensively, and I can totally understand what you say. But in Germany, we don't have that issue to that extent because the pediatric dentists do not, they don't do too much ortho.
They don't do very much.
No, they don't.
And final question, Align also bought OrthoCAD back in the day. Do you think that was a good purchase? And is OrthoCAD something that you use?
I was indeed one of the very few German AutoCAD users. That is like more than 10 years ago. I think we were 4 in total in Germany. So you're talking about this bracket positioning that was transferred, an optimized bracket positioning that was transferred via, like an aligner, like a positioning template. But they bought AutoCAD not because of that system, but because of the scanner. I think that from that point they developed the iTero. So I think it was a very good acquisition indeed, or very smart.
So I just want to know when they're going to buy a robot. There's Yomi the robot that's placing dental implants. When will you be able to stay home and drink a beer in your jacuzzi while a robot does all your orthodontic treatment?
Well, I don't know. What I know is that we have very smart people that predict that within 40 years, we will not have any jobs anymore because everybody can be done by artificial intelligence or robots. I think it will just be a different way to work. Maybe it will be in a way that we emphasize more on human values and what one can do for the other, and not only in a frame of being a doctor, being a lawyer, being something. Maybe it will be a totally different world where still some people will decide something and others less. I cannot answer that, but one day within the next decades, we will be there.
Well, I'm very excited about artificial intelligence because I have not been impressed by natural intelligence.
That's a good one.
And I can't let you go without a shout out to Leanne Ellermeyer. Tell the townies what your relationship is with Leanne Ellermeyer. She's the CEO at 2C MedTech and 2C Dental AG. You do a lot of business with her. Tell them your relationship with Leah.
Well, that's a longer story, but I will make it short. She's the wife of Rutger Ruppert, who is a German and an engineer for ortho that is just absolutely outstanding. And I got to know Rutger, and with him I also met Lee, and she is just one of the smartest women I have ever met in my life. It's a very interesting couple where he's he developed this ortho robot that was bending the wires, the wire bending machine, and from there he went with incognito or lingual care, and he did so many great things, technical developments in ortho. You should do an interview with him as well. And Lee is just a great CEO and a fantastic person that could work for any company and would do a tremendous job. And I'm just feel very honored to work with both of them. And I think if we will have in the future success with our Too Clear product, and it's because of them. Yeah, that's great people to have around.
So her husband is Christian Schultz.
No, Christian Schultz is another orthodontist that is also a very unique person. He's a venture capital guy that just has a very, very good outstanding talent to raise money, and that is very important nowadays. So without Christian, we would not be able to have a company. It's a startup. So from the product that I developed, that was not a company by then, because you need some funding. You need to raise the money if you don't want to be only with your own money in the high risk area, and that is at my age maybe not the smartest idea.
So her husband's in Rutger Ruppert?
The husband is Rutger Ruppert, yes.
Wow.
Of Lee Eller.
Wow, interesting. I just want. So how late is it there now? What time is it? 10 p.m.
It's almost 10 p.m. Yeah.
Well, hey, I'm so thankful that after a long day, how many patients did you see today?
Oh, Howard, it was only around 50.
Oh my gosh. So here you are on the other side of the world after a long day of seeing 50 patients. Before you go to bed, you had to stay up and talk to me and my homies for an hour and a half. I hope it doesn't give you nightmares tonight while you're sleeping. Thank you so much. And if you talking to Rudger Rubert, if he wants to come on the show, I would love to hear about the journey of Replicate Tooth and all the things he's done. I mean, I just love hearing these entrepreneur stories, and it's a good picker-up story, especially in this downtime where a lot of people are very stressed from this pandemic. I mean, it's just literally killing my mom. My mom's 82, and just the fact that her bowling league was canceled, I thought was almost going to kill her. So thank you so much for all that you've done for dentistry, for orthodontics, and for staying up tonight to talk to me and my homies. Night, and I hope you sleep well.
Thank you very much, Howard. It was a pleasure. And Lee already said that you are a great guy and fun to talk to, and she's 100% right. So anytime you want to talk again, you're very welcome.
All right. I'll see you at the next FDI meeting.
Bye.